The theme of my talk is infertility, a silent epidemic. Its magnitude, causes, consequences, treatment options, recent advances, and future trends. According to recent studies, India has witnessed a significant rise in infertility rates over the past decade. What was once a relatively uncommon issue is now being classified as a silent epidemic, affecting not only individuals but also societal structures and family relationships. Infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular, unprotected sexual intercourse. Infertility may occur due to male, female, or unexplained factors. Some causes of the infertility are preventable. Treatment of infertility often involves in-vitro fertilization (IVF) and other types of medically assisted reproduction. Worldwide, 8 to 12% of couples experience fertility problems. At least 20% of the infertility cases happen solely due to a problem with the male reproductive system. In addition, 19% of the American females aged 15 to 49 years experience primary infertility after 1 year of trying. About 6% of the married females aged 15 to 49 years experience secondary infertility. As per the World Health Organization, infertility affects around 1 in every 6 people globally, or 17.5% of the adult population. Infertility rates vary according to income level, with 17.8% in highly income countries and 16.5% in low and middle income countries. The statistics paint a stark picture of the growing infertility crisis in India. Approximately 27.5 million couples in India are grappling with infertility, and the numbers are expected to rise further. Urban areas report infertility rates as high as 15 to 20% compared to rural areas, where rates hover around 8 to 10%. Around 40 to 50% of the infertility cases are caused by male factors such as low sperm count, poor motility, or genetic conditions. Female infertility contributes to an equal percentage of cases and is primarily caused by hormonal disorders like PCOS, endometriosis, and age-related factors. In 10 to 15% of the cases, no specific cause can be identified despite extensive testing. The National Family Health Survey data highlights that infertility rates are rising faster in urban areas due to lifestyle changes, delayed parenthood, and higher levels of pollution. This trend has far-reaching social and emotional consequences. According to research studies, the prevalence of male infertility in India is around 10 to 15%, which means that out of every 100 couples trying to conceive, 10 to 15 couples may have difficulties due to male infertility issues. Infertility increases as the duration of the marriage reduces. Infertility is a significant global health issue. According to World Health Organization, 17.5% of the adult population worldwide, roughly 1 in 6 individuals, experience infertility during their lifetime. The prevalence of infertility affects millions globally with notable regional variations. Global fertility rates have been on a downward trajectory. In 1950, the worldwide average was about 5 children per woman. By 2020, this average had declined to 2 children. Why addressing infertility is important? Every human being has a right to the enjoyment of the highest attainable standard of physical and mental health. Individuals and couples have the right to decide the number, timing, and spacing of the children. Infertility can negate the realization of these essential human rights. A wide variety of people, including heterosexual couples, same-sex partners, older persons, individuals who are not in sexual relationships, and those with certain medical conditions such as some HIV serodiscordant couples and cancer survivors may require infertility management and fertility care services. If you and your partner are struggling to have a baby, you aren't alone. Millions of the people around the world face the same challenge. Infertility is the medical term for when you cannot get pregnant despite having frequent unprotected sex for at least a year for most couples. Infertility may happen because of a health issue with either you or your partner, or a mix of factors that prevent pregnancy. But many safe and effective treatments can boost your chances of getting pregnant. Infertility can affect anyone and has many causes. Getting pregnant involves several steps. Number 1, your brain must produce reproductive hormones that control ovarian function. 2, an egg must mature in your ovary. 3, your ovary must release an egg known as ovulation. 4, your fallopian tube must pick up the egg. 5, sperm must travel up your vagina and through the uterus to your fallopian tube. 6, the sperm fertilizes the egg to create an embryo. 7, the embryo travels through your fallopian tube to the uterus where it implants. A pregnancy cannot occur if anything in this process does not happen. Trying to conceive is defined as having regular, unprotected sex. If you are 35 or older, your doctor may diagnose infertility after 6 months of regular, unprotected sex. Infertility is more common than you might think. Fortunately, there are many treatment options available for women who wish to begin or expand their family. Infertility affects millions of people and has an impact on their families and communities. In the male reproductive system, infertility is most commonly caused by problems in the ejection of semen, absence of low level of sperms or abnormal shape, morphology, and movement, motility of the sperm. In the female reproductive system, infertility may be caused by a range of abnormalities of the ovaries, uterus, fallopian tubes, and the endocrine system, among others. Infertility can be primary or secondary. Primary infertility is when a pregnancy has never been achieved by a person, and secondary infertility is when at least one prior pregnancy has been achieved. Fertility care encompasses the prevention, diagnosis, and treatment of infertility. Equal and equitable access to fertility care remains a challenge in most countries, particularly in the low and middle income countries. Fertility care is rarely prioritized in national universal health coverage benefits packages. Causes. Infertility may be caused by a number of different factors. In the female reproductive system, infertility may be caused by tubal disorders such as blocked fallopian tubes, which are in turn caused by untreated sexually transmitted infections, or complications of unsafe abortion, postpartum sepsis, or abdominal pelvic surgery. Uterine disorders, which could be inflammatory in nature, such as endometriosis, congenital in nature, such as septate uterus, or benign in nature, such as fibroids. Disorders of the ovaries, such as polycystic ovarian syndrome, POS, and other follicular disorders. Disorders of the endocrine system causing imbalances of reproductive hormones. The endocrine system includes hypothalamus and the pituitary glands. Examples of common disorders affecting the system include pituitary cancers and hypopituitarism. In the male reproductive system, infertility may be caused by obstruction of the reproductive tract causing dysfunctionalities in the ejection of semen. This blockage can occur in the tubes that carry semen, such as the ejaculatory ducts and seminal vesicles. Blockages are commonly due to injuries or infections of the genital tract. 2. Hormonal disorders leading to abnormalities in hormones produced by the pituitary gland, hypothalamus, and testicles. Hormones such as testosterone regulate sperm production. Examples of disorders that result in hormonal imbalance include pituitary or testicular cancers. 3. Testicular failure to produce sperm. For example, due to varicocele or medical treatments that impair sperm producing cells, such as chemotherapy. 4. Abnormal sperm function and quality. Conditions or situations that cause abnormal shape, morphology, and movement, motility of the sperm negatively affect fertility. For example, the use of anabolic steroids can cause abnormal semen parameters such as sperm count and shape. Lifestyle factors such as smoking, excessive alcohol intake, and obesity can affect fertility. In addition, exposure to environmental pollutants and toxins can be directly toxic to gametes, that's eggs and sperm, resulting in their decreased numbers and poor quality. Symptoms. The main symptom of infertility is not getting pregnant. There may be no other clear symptom. Some women with infertility may have irregular menstrual periods or no periods, and some men may have some symptoms of hormonal problems such as changes in hair growth or sexual function. Many couples eventually will conceive with or without treatment. You likely do not need to see a doctor about infertility unless you have been trying to get pregnant for at least 1 year. But women should talk with a doctor sooner if they are age 35 or older and have tried to conceive for 6 months or longer, age 40, have no periods or irregular or very painful periods, have known fertility problems, have endometriosis, have had more than one miscarriage, have gotten cancer treatment such as chemotherapy or radiation. Men should talk to doctor if they have a low number of sperms or other problems with sperm. A history of testicular, prostate or sexual conditions, had treatment for cancer such as chemotherapy, had hernia surgery, testicles that are smaller than the typical adult size, or swollen veins in the bag of skin that holds the testicles called the scrotum, had infertility with a partner in the past, relatives with infertility problems. All of these steps during ovulation and fertilization need to happen correctly in order to get pregnant. Ovulation is the release of an egg from an ovary. Fertilization is when the egg and sperm unite to form embryo, which becomes an unborn baby during pregnancy. Risk factors. Many of the risk factors for both male and female infertility are the same. They include age. Women's fertility slowly declines with age, especially in the mid-30s. It drops quickly after age 37. Infertility in older women likely is due to the lower number and quality of eggs or to health problems that affect fertility. Men over age 40 may be less fertile than younger men. The risk of birth defects and genetic problems also rises for the children born to men over age 40. Smoking tobacco by either partner may lower the chances of pregnancy. Marijuana use may affect fertility. For women, there is no safe level of alcohol use when you are trying to get pregnant or during pregnancy. Alcohol may contribute to infertility. Being overweight can raise the risk of infertility. People at risk of fertility problems include those with eating disorders such as anorexia nervosa. A lack of exercise plays a role in obesity, which raises the risk of infertility. Prevention. Some types of infertility cannot be prevented, but the following tips may boost your chances of pregnancy. Couples have sex often soon after menstrual bleeding stops. One of the ovaries usually releases an egg in the middle of the cycle, halfway between menstrual periods. For most people with menstrual cycles about 28 days apart, it is ideal to have sex every day starting 5 to 7 days before the release of the egg. Continue until 2 days after ovulation. for men. Most types of infertility aren't preventable in men, but these steps may help. Stay away from drugs and tobacco, and don't drink a lot of alcohol. Don't take frequent baths in hot water. The high temperatures can have a short-term effect on sperm production and movement. Stay away from pollutants and toxins. Limit medicines that may impact fertility if possible. Regular exercise may improve sperm quality and boost the chances of pregnancy. For women, the following tips may boost the chances of getting pregnant. Quit smoking. Stay away from alcohol and street drugs. Limit caffeine. Exercise safely. Regular exercise is key for good health, but working out too intensely could cause your periods to happen less often or go away, and that could affect fertility. Get to a healthy weight. Being overweight or underweight can affect your hormones and cause infertility. While causes of infertility vary, research studies show that 33% of infertility involves women, 33% of infertility involves men, 33% of infertility involves both partners or is unexplained. 25% of infertile couples have more than one factor that contributes to their infertility. Risk factors for infertility include age, particularly being in your late 30s or 40s. For men, age begins affecting fertility closer to 50. Eating disorders, excessive alcohol consumption, exposure to environmental toxins such as chemicals, lead, and pesticides, over-exercising, radiation therapy or chemotherapy, sexually transmitted infections, smoking and using tobacco products, substance abuse, having obesity or being underweight, abnormalities of hormone producing centers of your brain, that is hypothalamus or pituitary, chronic conditions and diseases. Ovulation disorders are the most common causes of infertility in women. Ovulation is the process in which your ovary releases an egg to meet sperm for fertilization. These factors can contribute to female infertility. Endometriosis, structural abnormalities of your vagina, uterus, or fallopian tubes. Autoimmune conditions like celiac disease or lupus. Your immune system attacks your own tissue, leading to tissue damage and illness. Kidney diseases, pelvic inflammatory disease, hypothalamic and pituitary gland disorders, polycystic ovary syndrome. Polycystic ovary syndrome, primary ovarian insufficiency or poor egg quality, sickle cell anemia, uterine fibroids or uterine polyps, thyroid disease, prior surgical sterilization, tubal ligation or salpingectomy, genetic or chromosomal disorders, sexual dysfunction, surgical or congenital absence of your ovaries, infrequent or absent menstrual periods. The most common cause of male infertility involves problems with the shape, movement, or amount of sperm. Other causes of male infertility include varicocele, that is enlarged veins in your scrotum, the sac that holds your testicles, genetic disorders such as cystic fibrosis, chromosomal disorders such as Klinefelter syndrome, high heat exposure to your testicles from tight clothing, frequent use of hot tubs, and holding laptops or heating pads on or near your testes, injury to your scrotum or testicles, low testosterone, misuse of antibiotic, misuse of anabolic steroids, sexual dysfunction such as erectile dysfunction, premature ejaculation or retrograde ejaculation, undescended testes, previous chemotherapy or radiation therapy, surgical or congenital absence of testes, prior surgical sterilization known as vasectomy. Diagnosis of infertility. Fertility for females involves ovulating healthy eggs. This means your brain has to send hormonal signals to your ovary to release an egg to travel from your ovary through your fallopian tube and to your uterine lining. Fertility testing involves detecting an issue with any of these processes. These tests can also help diagnose or rule out problems. 1. Pelvic examination. Your doctor will perform a pelvic examination to check for structural problems or signs of disease. 2. Blood test. A blood test can check hormone levels to see if hormonal imbalance is a factor or if you are ovulating. Transvaginal ultrasound. Your provider inserts an ultrasound wand into your vagina to look for issues with your reproductive system. Hysteroscopy. Your doctor inserts a thin, lighty tube hysteroscope into your vagina to examine your uterus. Saline sonohysterogram, SIS. Your doctor fills your uterus with saline, sterilized salt water, and conducts a transvaginal ultrasound. Sonohysterosalpingogram, HSG. Your doctor fills your fallopian tubes with saline and air bubbles during an SIS procedure to check for tubal blockage. X-ray hysterosalpingogram, HSG. X-rays capture an injectable dye as it travels through your fallopian tubes. This test looks for blockages. Laparoscopy. Your doctor inserts a laparoscope into a small abdominal incision. It helps identify problems like endometriosis, uterine fibroids, and scar tissue. Diagnosing infertility in men typically involves making sure they ejaculate healthy sperm. Most fertility tests look for problems with sperm. These tests can help diagnose or rule out problem. Number 1. Semen analysis. This test checks for low sperm count and poor sperm mobility. Some people need a needle biopsy to remove sperm from their testicles for testing. 2. Blood test. A blood test can check thyroid and other hormone levels. Genetic blood tests look for chromosomal abnormalities. 3. Scrotal ultrasound. An ultrasound of your scrotum identifies varicoceles or other testicular problems. Complications of infertility. Complications that can arise due to infertility include emotional and psychological stress, increased risk of miscarriage, ovarian hyperstimulation syndrome, which is swollen, painful ovaries, multiple pregnancies, health concerns from underlying causes, infertility causing conditions such as endometriosis, male factor infertility, or polycystic ovarian syndrome can also result in chronic pain, hormone imbalances, or cardiovascular problems. Then social and financial stress. Also complications following treatment, that is infection, scars, or harm to the reproductive organs. An obstetrician, gynecologist, or a reproductive endocrinologist may diagnose infertility based on medical history and physical examination, ovulation evaluation, hormone testing, ultrasound, X-ray. Male infertility tests and diagnosis assess sperm count, motility, and hormone abnormalities to establish the optimal treatment plan. Common diagnostic tests that are done in males for diagnosing infertility include semen analysis. A sample of semen is collected and examined in a laboratory. The expert may evaluate the sperm count, test motility of the sperm, check the shape of the sperm, evaluate the ejaculate liquid. Other tests may be performed to examine the sperm's capacity to fuse with the egg, as well as male hormone testing. Infertility treatment. The doctor may discuss the best treatment based on the patient's age, overall health and medical history, how well the patient can handle specific procedures, medications, or therapies, how long the condition is expected to last, the patient's preferences. Types of treatments for women may include intrauterine insemination. This technique inserts carefully cleaned and prepared sperm straight into the uterus using a tiny flexible tube known as catheter. Ovulation medicine. These medications help to regulate the timing of the ovulation. Some of the common medicines include estrogen receptor modulators, human menopausal gonadotropins, follicle stimulating hormone, and then surgery may be used to treat or repair a condition such as blocked fallopian tube or endometriosis. Assisted reproductive technology, ART. Some couples require more comprehensive treatment. In most types of the ART, the sperm and egg are combined in the laboratory. The fertilized egg is subsequently returned to the woman's uterus to implant and develop. While ART procedure can be expensive, many are successful. These include in-vitro fertilization, intracytoplasmic sperm injection, gamete intrafallopian transfer, zygote intrafallopian transfer, donor eggs. This involves transferring an embryo from a donor to the infertile woman. Then freezing of embryo cryopreservation. Male factor infertility has a variety of treatment options available, which include assisted reproductive technologies. This type of treatment may include artificial insemination, procedure in which sperm is introduced into a female's reproductive system in order to induce pregnancy. 2. In vitro fertilization, IVF. gamete intrafallopian transfer GIFT and other techniques. 3. Microsurgical fertilization, that is micro injection techniques such as intracytoplasmic sperm injection. Medicine therapy includes hormone therapy, gonadotrophin therapy, and antibiotics. Surgery for male infertility is performed to correct anatomical issues that prevent sperm production, maturation, or ejaculation. Difference between sterility and infertility. Sterility and infertility both impair the capacity to conceive, although their duration and causes differ. While sterility is a lifelong, irreversible illness, infertility can be transient and treatable, with medical procedures providing the opportunity for conception in many situations. In vitro fertilization (IVF) involves retrieving eggs from your ovary, then placing them with sperm in a lab dish. The sperm fertilizes the eggs. A doctor transfers 1 to 3 of the fertilized embryos into your uterus. Intracytoplasmic sperm injection. This procedure may be performed during the IVF process. An embryologist injects a single sperm directly into each egg. Then a doctor transfers 1 of the 3 of the embryos into your uterus. Intrauterine insemination. A doctor uses a long, thin tube to place sperm directly into your uterus. This procedure is sometimes called artificial insemination. Assisted hatching, a process that involves opening the outer layer of an embryo to make it easier for it to implant in your uterine lining. Third-party ART. Couples may use donor eggs, donor sperm, or donor embryos. Some couples need a gestational carrier or surrogate. Complications of infertility treatment include higher chances of multiples, that is twins, triplets, or more. Ovarian hyperstimulation syndrome, a condition that causes painful and swollen ovaries. Ectopic pregnancy, failed cycles. What can you expect if you have infertility? Approximately 9 out of 10 couples get pregnant after undergoing fertility treatments. Success rates vary depending on the cause of infertility, the couple's ages, and other factors. Infertility has emotional, physical, financial, and psychological side effects. Infertility isn't easy, so surround yourself with supportive people, or consider joining an online support group. Sometimes sharing your feelings with people who understand what you are going through can be helpful. A brief about lifestyle factors. Modern urban lifestyles are a significant contributor to rising infertility rates. 1. Stress and anxiety. Chronic stress disrupts hormonal regulation in both men and women. 2. Obesity and sedentary lifestyle. Excess weight is associated with insulin resistance and hormonal imbalances that affect ovulation. 3. Delayed parenthood. Many couples postpone parenthood for career or financial reasons, leading to age-related infertility. 4. Smoking and alcohol consumption. These habits significantly reduce sperm quality and ovarian function. Environmental factors include pollution. Air, water, and soil pollution impact reproductive health, leading to declining sperm counts and egg quality. 2. Pesticides and chemicals. Agricultural and industrial workers exposed to pesticides and toxins face higher infertility rates. Challenges faced by couples with infertility include: number 1, societal stigma and gender bias. 2. Lack of awareness. 3. High costs of fertility treatments. 4. Limited healthcare access in rural areas. 5. Emotional and psychological stress. Key priorities moving forward is breaking the stigma, encouraging open conversation with infertility, encouraging open conversation about infertility will help reduce social pressures and gender bias. Improving access, expanding fertility care to rural areas through government policies and private partnership. 3. Research and innovation, investing in reproductive technologies to improve success rates and make treatments affordable. 4. Holistic care, focusing on lifestyle interventions, emotional well-being, and comprehensive medical support for couples struggling with infertility. Coping with support. Coping with infertility can be very hard because there are so many unknowns. The journey can take a serious emotional toll. These steps can help you cope. Be prepared. The uncertainty of infertility testing and treatments can be stressful. Ask your fertility doctor to explain the steps and prepare for such one. 2. Set limits. Before you start treatment, decide which procedures and how many you can afford financially and accept emotionally. 3. Think about other options. 4. Seek support. 5th, manage stress during treatment. 6th, managing emotional effects of the outcome. 7. Medical treatment for infertility. A brief about in vitro fertilization, IVF. One of the most well-known and effective fertility treatments, especially for individuals or couples with more complex fertility challenges. IVF involves several steps. Step number 1, ovarian stimulation. Fertility medications are used to stimulate the ovaries to produce multiple eggs. Number 2, egg retrieval. Once the eggs are mature, they are retrieved from the ovaries using a minimally invasive procedure. Number 3, fertilization. The eggs are fertilized with sperm in a laboratory setting, either through traditional IVF or intracytoplasmic sperm injection, where a single sperm is injected directly into an egg. 4. Embryo culture. The fertilized embryos are monitored in the lab for several days to ensure healthy development. 5. Embryo transfer. One or more healthy embryos are transferred into the woman's uterus. IVF is often recommended for blocked or damaged fallopian tubes, severe male infertility, endometriosis, unexplained infertility, failed IUI treatments. While IVF has high success rates, it is also one of the most expensive and time-consuming fertility treatments. Success rates vary based on factors such as age, egg quality, and the number of embryos transferred. A word about intracytoplasmic sperm injection. ICSI. It is a specialized form of IVF used primarily for male infertility. In traditional IVF, eggs and sperm are combined in a lab and fertilization occurs naturally. While ICSI, a single sperm is directly injected into an egg, increasing the chances of fertilization. ICSI is typically used when there is severe male infertility, that's low sperm count, poor motility, or abnormal morphology, shape. Previous IVF attempts have failed, or there are issues with sperm binding to or penetrating the egg. Once fertilization occurs, the embryos are cultured and transferred to the woman's uterus, just like a traditional IVF cycle. Surgical fertility treatments. For some individuals, surgery may be required to correct physical issues that are preventing pregnancy. Common surgical treatments include laparoscopy. This minimally invasive surgery can be used to diagnose and treat conditions like endometriosis, ovarian cysts, and blocked fallopian tubes. During the procedure, a small camera is inserted through a tiny incision in the abdomen, allowing the surgeon to view and repair any abnormalities. Hysteroscopy. Hysteroscopy is a procedure that involves inserting a thin lighted tube through the cervix into the uterus. It can be used to remove uterine polyps, fibroids, or scar tissue that may be affecting fertility. Tubal surgery. For women with blocked or damaged fallopian tubes, surgery may be performed to repair or unblock the tubes, improving the chances of natural conception. Surgical treatments are typically recommended when there is a clear physical issue affecting fertility, such as blocked fallopian tubes or endometrial abnormalities. A word about egg or sperm donation. For individuals or couples who cannot conceive with their own eggs or sperm, third-party reproductive assistance is an option. This involves using donor eggs or sperm to achieve pregnancy. Egg donation. Women who are unable to produce viable eggs due to age, ovarian failure, or genetic conditions may use donated eggs. The donor's eggs are fertilized with the male partners, that is, or donor sperm, and the resulting embryos are transferred to the recipient's uterus through IVF. Sperm donation. For men with severe male infertility, sperm donation is an option. The donor sperm is used for IUI or IVF to achieve pregnancy. Egg and sperm donation can be a highly effective option for individuals who otherwise have limited chances of conceiving. Now, surrogacy. Surrogacy is a fertility treatment option for individuals or couples who are unable to carry a pregnancy to term. There are two types of surrogacy. Traditional surrogacy. The surrogate uses her own egg and carries the pregnancy for the intended parents. The sperm can come from the intended father or a donor. This type of surrogacy is less common due to legal and emotional complexities. Gestational surrogacy. The surrogate carries an embryo created through IVF using the intended parents or donor's eggs and sperm. The surrogate has no genetic connection to the baby in this case. Surrogacy is often chosen by individuals or couples who are unable to conceive or carry a pregnancy due to medical reasons, such as uterine abnormalities or repeated pregnancy loss. The latest advances in IVF technology. What's new? Artificial intelligence, AI, in embryo selection. Artificial intelligence is revolutionizing embryo selection by analyzing huge data sets to identify the healthiest embryos for transfer. Artificial intelligence algorithms evaluate embryo images, predict implantation success, and recommend the best options. Improved success rates, reduced miscarriages, and faster treatment cycles are some of the benefits. CRISPR gene editing for embryo health. Still in its infancy, CRISPR technology is being explored to prevent genetic disorders in embryos. Researchers are focusing on precision editing techniques to eliminate inherited diseases. Strict guidelines are being enforced to ensure ethical use. Time-lapse imaging systems. Time-lapse imaging systems provide continuous monitoring of the embryo during development. This technique helps embryologists to select the best embryos without harming their environment. Improved implantation rates and a better understanding of embryo development is the result. Number 4, microfluidics for sperm and egg selection. Microfluidics, a cutting-edge method, is being used to select the healthiest sperm and egg. This technique mimics natural breeding processes, thereby improving the quality of gametes. Higher chances of fertilization and successful pregnancy outcomes are expected. Number 5, low-cost IVF technologies. To make IVF more accessible, researchers are developing cost-effective techniques without compromising on quality. Example is simplified laboratory equipment and techniques designed for low-resource environments. Impact: wider reach for couples from rural and economically backward areas. Number 6, wearable hormone monitors. Keeping track of hormone levels is very important during IVF. Wearable devices now provide real-time data to doctors and patients. The benefit is personalized treatment plans and less stress for patients. Now we talk about advances in assisted reproductive technology beyond IVF. Number 1, ovarian rejuvenation. Ovarian rejuvenation uses PRP, platelet-rich plasma therapy, to stimulate egg production in women with low ovarian reserves. Uterine transplants. Uterine transplantation is now a viable option for women whose uterus is not functioning. With advances in surgical techniques, success rates are improving. Number 3. Personalized medicine in fertility treatments. Every individual's fertility journey is unique. Advanced diagnostic tools are enabling doctors to tailor treatments based on genetic and hormonal profiles. Advances in fertility treatment continue to transform the landscape of reproductive medicine, offering new hope and options for individuals and couples trying to conceive. Advancements in assisted reproductive technologies, personalized treatment through genetic profiling, innovations in cryopreservation and egg freezing, integration of artificial intelligence in fertility clinics. Artificial intelligence is making a tangible impact in fertility treatment, particularly in enhancing the precision and efficiency of diagnostics and treatment planning. AI algorithms are being used to analyze complex data sets for previous treatment cycles, helping clinicians predict treatment outcomes with higher accuracy. This data-driven approach assists in tailoring protocols to individual patients, optimizing medication dosages, and timing embryo transfers more effectively. Moreover, artificial intelligence-powered systems are now integrated into laboratory procedures, from automated sperm analysis to embryo selection. These tools reduce human error and improve consistency across treatment cycles. The incorporation of artificial intelligence not only speeds up the process, but also increases the likelihood of a successful outcome, making fertility treatments more accessible and reliable for patients. Techniques such as mindfulness-based stress reduction, acupuncture, and targeted nutritional plans are gaining traction as complementary therapies. As part of holistic and integrative approach to deal with infertility. Looking ahead, what is next in fertility treatments? Innovations in areas like regenerative medicine and stem cell research they are on the horizon, with the potential to revolutionize how we approach fertility preservation and treatment. Scientists and clinicians are collaborating more closely than ever to push the boundaries of what is possible, ensuring that fertility care keeps pace with the latest scientific advancements. The application of genomic medicine in fertility extends beyond initial screenings. It includes ongoing assessments throughout the treatment process. Regular monitoring through genetic profiling can track how well a treatment is working. If a patient does not respond as expected, adjustments can be made promptly. This adaptability is crucial for achieving desired outcomes in fertility treatments. Moreover, genomic advances pave the way for future innovations. Researchers are exploring new ways to integrate genetic information into routine fertility care. As this field evolves, patients will likely see even more tailored options. Numerous clinical trials are currently exploring the use of stem cells in reproductive health. These trials focus on various applications, including ovarian rejuvenation and sperm production. Researchers aim to determine how effective stem cells can be in restoring fertility in patients facing challenges. As these technologies evolve, they may open new avenues for understanding infertility causes and solutions. Clinics that embrace these edge technologies will stay ahead in providing high quality care. Microfluidics revolutionizes reproductive medicine through enhanced sperm analysis and embryo handling. Cutting-edge ovarian rejuvenation methods aim to restore the function of aging ovaries. One notable approach is the use of platelet-rich plasma. Stem cells are used to regenerate ovarian tissue. Initial trials suggest it may improve hormone production and egg release. These advancements provide hope for women facing fertility challenges due to aging. Robotic-assisted reproductive techniques. Recent years have seen a surge in robotic-assisted surgeries for fertility treatments. These advancements aim to improve the effectiveness of reproductive health procedures. Surgeons now use robotic systems such as the Da Vinci surgical system to perform complex operations with enhanced precision. This technology allows doctors to manipulate instruments with greater accuracy than traditional methods. Robotic techniques have transformed how some fertility procedures are performed. For example, laparoscopic surgeries, which involve small incisions, benefit from robotic assistance. This approach minimizes damage to surrounding tissues and reduces recovery time for patients. Recent advances in cryopreservation techniques have transformed fertility treatments. New protocols improve the freezing and thawing processes for gametes and embryos. Vitrification is now a standard method. This technique involves rapid cooling, preserving ice crystal formation. Ice crystal can damage cells during traditional freezing methods. Scientists explore new cryoprotectants. These substances protect cells from damage during freezing. Improved cryoprotectants enhance cell viability after thawing. They allow for better embryo selection in assisted reproductive technologies. Improved freezing techniques significantly affect long-term viability. With enhanced methods, embryos can survive longer storage periods. This leads to higher success rates during implantation. Data from fertility clinics show that frozen embryos have comparable success rates to fresh ones. Artificial intelligence's potential in fertility treatment extends beyond the individual interventions and into broader integrative solutions. One promising direction is the integration of AI with telemedicine platforms, enabling remote consultations and continuous monitoring of reproductive health. Hope sustains life. Thank you for your patience here.